Hello, my friend. How are you? Thank you so much for joining groupTHINK 007. My name is Troy Alexander, and today our guest is Dr. Hadley King. Welcome.
Thank you, Troy. I appreciate the invitation. I'm excited to talk to you.
So, I just want to kind of get in our conversation and say, the introduction is, can you hear me?
Yeah, I can hear you.
Okay, perfect. Yeah. I want to kind of get into this and say, again, thank you for joining. Something went wrong. You went wrong.
That was me. That was my fault. Sorry.
Okay, cool. I just want to make sure. So anyways,
yeah.
Welcome. And sorry for the people who are listening. If you hear me say this again, today we have a rock star, Dr. Hadley King. She will be dropping some crazy gems on skin health during COVID-19 and post. And you don't want to miss this. She's one of New York City's sought after dermatologists and a personal friend. So thank you, Doctor. Welcome.
Thank you for the very nice introduction, Troy.
So, Dr. King, you have a famous fucking last name. I mean, that's pretty dope, Dr. King.
Yes, I love that.
And you graduated, magna cum laude from Harvard. Shut the front door. I never fucking knew that, right? You're wicked smart. And, introduce yourself. Give us a little bit about you as we sit here and talk, please.
Okay, all right. So I'm a board certified dermatologist practicing mostly in New York City.
Okay.
So I do a few different things there. I'm in one practice where I've been for about 12 years with Dr. Doris Day. And I joined her practice. She's a very sought after dermatologist. She does a lot of TV work. So it's been, very educational for me to learn from her and to be with her for this long. In that office, I do medical dermatology, surgical dermatology, and plenty of cosmetics.
Okay.
And then I also have my own practice, which is much smaller, further downtown, and that is completely cosmetic. So that's been fun to learn kind of the business side of things a bit, trying to build that. And then I also teach at Cornell, which is in the city. So I work with the dermatology residents in the clinic at the hospital. So that's very academic and keeps me on my toes because, they're right in the midst of learning everything. So sometimes they know stuff that I've forgotten, and we see very interesting cases there. So that's nice.
Okay.
And then in addition to that, I also work a few days a month in Presque Isle, Maine, which is far remote northern Maine, and it's an area that actually does not have any dermatologists, which I know as a Manhattanite that's hard to imagine, but they actually don't have any for a population about the size of Connecticut and Rhode Island combined. Okay. So there, I go with one colleague, one other dermatologist goes, and we see lots of patients up there, severe psoriasis, skin cancer, eczema. So that is also a very different part of my job. It's very gratifying.
Okay, and so in your bio, it says that you studied, biochemistry at Harvard. Can you tell us about your background and what made you specialize in dermatology?
Yeah, good question. So I grew up in Pensacola, Florida, which is where I happen to be right now. I'm writing out the pandemic while I can't see patients in person. And it was a great place to grow up where a lot of life was focused on nature, and I think that really instilled in me a love of the natural world and science, and just a lot of curiosity about that. So since a very young age, I was driven towards the biological sciences and molecular biology eventually. And so I went to Pensacola High School, and I was very fortunate to get into Harvard. So that was a big change from, Pensacola High to Harvard and Boston. So in all ways, culturally, weather, academics. So I'm very grateful for that because I think it really affected my life trajectory. And I had an amazing experience there, exposed to so many smart and interesting people. So there I studied biochemistry, because really my favorite thing is molecular biology, DNA and RNA and that stuff. So that was the thing to concentrate on if those were your loves. So I started that, and I worked in a lab there too, doing a lot of molecular immunology. That's where I did my thesis. And interestingly, there's a lot of molecular immunology and dermatology. So I think that translated very well for me.
Okay.
So there I was in undergrad studying sciences, and I I had thought at one point that I might pursue kind of the PhD route and just stick with pure biochemistry, molecular biology, the science part of it. But after a couple of years of working in the lab there, I realized that it didn't offer as much like human interaction as I wanted. It could be a bit of a solitary lifestyle in a way, because you're just kind of repeating experiments over and over. And although like the methodical part of my brain loves that, I did miss more human interaction. So I kind of felt like that left the reasonable alternative of med school. So that's when I started thinking about med school, and I ended up at Columbia in New York City for that. And so that's what brought me to New York, and I've been there ever since. So that's been an amazing part of my life as well. So at Columbia, you know, in med school they structure it so you get to try out everything and kind of see which fields you like. And dermatology definitely appealed to me from day one, because I'm very visually oriented, and I was just awestruck by how some of the senior dermatologists could look from like across the room and know exactly what was going on with the patient just from like subtle manifestations in the skin. Like I thought that was just the coolest thing. Wow. So yeah, dermatology is kind of unique in medicine in how visual it is, and also dealing with people. The other fields that are so visual are like radiology and pathology, but you're not really dealing on a daily basis one-on-one with patients. So dermatology is great that way. Plus, of course, as I mentioned, the molecular immunology, I like that a lot. And it also lets you work with your hands, which I really enjoy doing procedural work without it being like the major stress of open heart surgery or something like that. So it's a good fit for me.
Okay, wonderful. I mean, it's so intense. I mean, like mind blowing. So one quick question, you know, so Pensacola, Harvard, and what was your experience from Harvard to Columbia? Like, explain that experience.
So I think, I mean, nothing, like I have such a warm place in my heart from my Harvard experience, because it was just so life-changing, and the people I was surrounded with were so interesting and curious about all different things. Once you get to med school, it's a bit more focused. And so I probably wasn't, you know, awestruck on a daily basis as much there, because there was more people like me, more science-oriented people. But it was still certainly an amazing experience, and I appreciate all the great teachers that I had there, and the opportunities that you know opened as far as eventually leading to my career in dermatology, which I think is an excellent match for me.
Okay, fantastic. So what area of dermatology do you specialize in, and what aspects of it do you enjoy the most?
So I really do all types of dermatology, but I consider my specialties to be skin cancer, acne, and cosmetics. So my first job after Columbia, then the next step in the long road to being a practicing doctor is internship. So that took me to Yale in Connecticut. And that year you do general internal medicine. And then after that you do 3 years of a dermatology residency, and I did that at Cornell. So that was back in the city. So you know, you're learning all aspects of dermatology. Less so with cosmetics, actually. Usually the training is focused a bit more on the academics, the medical, and the surgical. But my first job that I took after that was at Sloan Kettering, the Cancer Institute. So I started my career really focusing on just skin cancer, particularly melanoma, and then also skin problems that people with other types of cancer might experience because of their cancer or because of their cancer treatment. So that was my first job, and because of that, I still do a lot of skin cancer, and that's been something that I do a lot of in Maine as well. Because interestingly, despite how cold it is up there, it's an agrarian economy, and lots of farmers who've gotten lots of sun over the years, and it's a pretty pretty white population as well. So sun plus white, but yeah, lots of skin cancer. So that's been, you know, a focus of my career kind of throughout. And I really like that, because of course it's just, you know, super important to be able to diagnose these early, because when diagnosed early, the prognosis is excellent. But skin cancer is one of those things that melanoma in particular, if diagnosed too late, it can be unfortunately quite fatal. So, so that is one focus. And then cosmetics, definitely a fun part of the job. And Dr. Day, who I work with on the Upper East Side, she focuses a lot on cosmetics. So it's been great to be able to learn from her and experience that. I also spent some time at a med spa, so that also helped me hone my skills there. And I find it gratifying. You know, usually for me, I will have developed a relationship with patients based on skin cancer checks or acne or treating them otherwise. And so we've already developed a trust and, you know, a good relationship. And then, you know, they're aging as I'm aging, and they start to ask questions about, oh, do you also do Botox?
Right.
Do you also do lasers? And so then we can kind of transition into doing some of that stuff too. And I like that. Yeah, it means that they trust me, and I can help them feel better about themselves. I can help them feel better about, you know, if they're going through a divorce, or they're looking for a new relationship, or they're looking for a new job and they want to feel confident in the market there, then just things that I can do to help boost their self-image is very gratifying. And then the last thing is acne. Acne is actually my number one favorite. Because I know, you know, what a huge impact it takes on how people see themselves. And it strikes at such a, you know, as teenagers, we are the most self-conscious of our lives. Like there's so much peer pressure. So it's like a cruel irony that that's when acne happens. So I love being able to treat these kids. And, you know, when I first start seeing them, they won't even make eye contact with me. Right. And then as they're getting better, they start to, like, they're so appreciative, and they smile when they see me, and they're so much more confident. It's great. And then lots of adult acne, particularly in women. So those are my favorites.
Okay. And so what is the percentage of men versus women that are coming to see you? And are men coming in for cosmetic procedures or acne, skincare, things like that?
Yeah, interesting question. So I would say probably overall, out of everything I do, the breakdown is going to be probably like 30% men, 70% women.
Okay.
But it does depend. For example, in Maine, I actually probably see more men than women, because more men have been the farmers, and they're suffering from all the skin cancers, and so they have to come in more. And that population, it's all medical, and yeah, I would say I see more men.
What about New York City? What about the great city?
Yeah, so in cosmetics, it is definitely more women, like 60 to 70% women. Okay. But even in the time that I've been practicing, so about 12 years or so, I have seen that shifting. Yeah, I think men are becoming more aware of what the options are and more accepting of it, and they're starting to try out these great procedures a bit themselves. Which
and can you elaborate on those great procedures?
For sure. So Botox is very popular with men.
Okay. Age range for us?
I mean, it certainly depends on the person, but I would say, you know, 35 plus.
Okay. Wow.
Yeah. And you're right, completely depends on the person, but the general guidelines I give people about when is it right to start Botox. So Botox works for the lines in the face that come from facial expression. So we're not talking like the smile lines here, but more the ones that come from expression. So like the vertical lines there from wrinkling your brow, and the horizontal lines here, and the crow's feet. There are other areas where we use it also, but those are three most common areas. Okay. And if you notice those lines when you make the expression, but when you're not making the expression and your face is at rest, the lines aren't there, you have time and you can wait. If you're starting to see that the lines are sticking, they're still there, then it's time to consider it so they don't get etched in.
Okay. And so this is fascinating. I have some more questions about that, but at the bare bones, what should someone be doing to take care of their skin?
So the single most important anti-aging thing that you can do for your skin is sun protection. Hands down, that is going to make the biggest difference over time. And that means on an everyday basis. There have been some great studies done that compare the aging of the skin of people who just use sun protection on days that they think they're going to be outside a lot, or maybe they're going to the beach, versus people who do it on an everyday basis. And there's a huge difference in how their skin ages. So it really is important on an everyday basis. A lot of the sun we get accumulates from just the daily incidental exposure. So you're not safe, even if you don't think it's a big sun day, you still need to be wearing sun protection.
And so sorry to cut you off, I'm sorry, go ahead.
No, go ahead.
And for people who don't understand, why is SPF so important? Is it as important for a Black person or a person of color or a white person? Like, can you elaborate on all of that, please?
Yeah, so actually, I think a hard question. Because of how research has been done over time, we know a lot more about the effects of UV rays on lighter skin types. We just don't have as much information, as much data about what they're doing. But remember that skin color is a continuum. So yes, the more pigment potential you have in your skin, the more protected you are from the sun, but it doesn't mean that you're not still affected. I've certainly seen sun-related skin cancers in all skin colors. But yes, the more pigment potential you have, the more protection you have. But it still contributes to different aspects of skin aging. And for example, for a very fair person, that might first be showing up as fine lines. For a darker skin person, it might be showing up as discoloration. And so, these different aspects, so there's no skin type that's safe from the effects of the sun. So I think it's important for everyone. Okay. And then there's always the question of vitamin D. Right. And I think most of us, particularly in places like New York City, could benefit from more vitamin D. Yeah. But we tend to see this particularly in darker skinned people. But everyone can take a vitamin D supplement, and it kind of takes that out of the equation, because how efficiently your skin is making vitamin D is quite variable. So a supplement is really a good answer for that.
Okay, and that leads me to my next question. We're all on lockdown, and people are not going outside because some people are afraid. And so you just answered the question. So people should be really kind of thinking about taking vitamin D supplements, right?
Yes, that's right. And remember that UVA rays penetrate through glass windows.
Correct.
So so you still should be thinking about sun protection, even though you're spending your time inside.
Okay. There are a lot of magic bullets out there, like vitamin A, vitamin C, hyaluronic acid. Can you tell us the real deal behind these ingredients? Like, tell us the real.
Yeah. So, all right, when I'm telling people, what do I think are like the very most effective things that you can do for your skin? So number one, sun protection, no question. In my opinion, the second most important anti-aging step you can do is a vitamin A derivative. So that's a retinoid, or over-the-counter retinol, okay. Or adapalene is also available over-the-counter. And so these are very powerful molecules that act as transcription factors in our skin, and so they can have huge effects. So they increase the turnover of the skin cells, so you're getting nice glowy skin cells on top, and it prevents, that helps prevent the cells sticking together and clogging up pores, so it also helps with acne.
Your skin is glowing over there.
That might be the lighting, but thank you. It also helps with fine lines, wrinkles, because it's increasing collagen and elastin, and it helps decrease discolorations. So retinoids do everything good. Yes, they can also cause irritation. So sometimes people get scared of using them because they experienced redness and peeling when they first started trying it. One, they come in a ton of different strengths and formulations. So there's probably a formulation that will work for you. And two, your skin does get used to it over time. So even if you get some irritation in the beginning, that'll likely go away. So yeah, number one, sun protection. Number two, vitamin A derivative. If you want to add in a third, I do think an antioxidant topical is important. And the most common there is vitamin C. Okay. There are lots of other antioxidants, but that tends to be the one that we read about the most. So our skin is constantly getting bombarded by free radicals. A lot of that comes from sun exposure.
And
but
can you explain the word free radicals and antioxidants for people who don't know and people who are listening?
Yeah, for sure. So basically, these are unstable molecules that do damage to our skin because they're looking for electrons. And so that can lead to DNA damage or damage of other proteins as well. So that's how, when we talk about things being bad for our skin, like sun or pollution, a lot of that effect is coming from the damage done by free radicals. And an antioxidant is something that neutralizes the free radicals so that it's no longer dangerous. Okay. So antioxidants include things like vitamin C. Okay. Vitamin E is also an antioxidant, and then there are tons of other things that are also antioxidants. Right now, natural beauty, natural skincare is so hot, and a lot of the jojoba oil, argan oil, a lot of the botanicals are rich in antioxidants as well. And so that's going to really help protect your skin from the effects of sun and pollution. So that's important during the day. So I recommend sun protection and antioxidants during the day and a retinoid at nighttime. And then, of course, that's in addition to just regular gentle cleansing, moisturizing, and exfoliation.
Okay, this is wonderful. And thank you for sharing all of this, And so another question, how important is diet when it comes to your skin? Are there certain foods that are proven to help? And a follow-up with that, should we, everyone right now is drinking constantly right now. They're in their homes, they're consuming tons of alcohol. How is the effect of alcohol on our skin?
All right. So diet. It's a great question, and it comes up a lot. And I think that overall, if you think about what diet is good for your skin, it's the same as what diet is good for your body. Mm-hmm. So we want healthy fats to support the fats that we have in the cell barrier, so that we don't dry out. So that's important. So you don't have dry skin. We also need proteins, good lean proteins, so that we have the building blocks to make keratin. That's the main structural protein in the skin, as well as all the other proteins. And then things like antioxidants, which we usually get mostly from fruits and vegetables. That's going to help, protect our whole body from the damage from free radicals. And then other vitamins, vitamin C is crucial for our body, how it makes collagen, for example. So you need all those vitamin cofactors and antioxidants, lean proteins, healthy fats. So that's overall kind of the big picture of, what's good for your skin is good for the rest of your body as well. But we do have some information about, specific dermatologic conditions and what diets are helpful for those. So for example, with acne, we have learned that dairy products, at least for some people, can increase acne. And there's some studies have shown it's more the fat component of dairy. Other studies have shown it might actually be the non-fat component, the protein part. But yes, dairy seems to be able to play a part with acne. And same with high glycemic foods. So that's foods that are high in refined carbohydrates, so sugar, carbs. Those things also can increase acne, probably because they affect our hormones, and hormones affect acne.
Okay, this is wonderful. I mean, this is a lot of knowledge that you're sharing. You're dropping some incredible gems. Love it.
Thank you, Troy.
And so, is there a difference in how men and women should be taking care of their skin?
For the most part, I don't think so. Okay. We our skin is structured in the same way. Now, with that said, of course, different concerns come up. In general, for example, women are going to be more concerned about, let's say, laser hair removal, for example, or even early signs of aging. Most women may be more concerned about than men, although I do think that's evolving.
Yes, I agree.
Yeah. But the basic structure is the same, and the active ingredients that are helpful are going to be the same. Women do tend to have thinner skin, and then especially that gets accentuated around menopause.
Okay.
And so they're going to be trying to fight those changes in a way that men are probably not going to have to deal with in the same way, or most men won't have to. Their skin's not going to thin as much. But overall, you know, what's going to be good for female skin is generally going to be good for male skin as well. There are some, you know, like hormone specific things that we can use for women that we can't use for men.
Okay. Can you elaborate on that a little bit? Yeah.
So, for example, when we treat acne, this is a little bit simplified, but in general, a lot of the acne that women experience come from their male hormones. And we all have male hormones, it's normal, we're supposed to, but it's genetically determined how sensitive your oil glands and your hair follicles are to these male hormones. And so women who experience hormonal acne, it's those male hormones that are to blame. So so medications like, there's one named spironolactone that decreases the male hormones, is an amazing treatment for adult women who are dealing with acne and thinning of the hair as well. It works very well, but you can't give that medication to men because you can't decrease their male hormones. They can start to grow some breast tissue, for example. We don't want any of those side effects. So it's just not an option. So, you know, so there are different approaches like that. Same with, you know, a common treatment for hair loss in men is alopecia, and you can't use that in women. So there are some things that come up because of hormonal differences.
And so as we continue, for people who don't like medication, are there any natural remedies that you could use?
Yeah, I think that we learn more and more about what can be options. For example, like since we were talking about hormones, saw palmetto is something that can be having some of those effects on male hormones, and so that's been effective for prostate health, and some people think it can possibly be helpful for hair loss as well. So there are some alternative treatments. And you know, and we do try to focus on like vitamin C, for example. Yeah, sometimes the molecule is manufactured, but it's still overall we're thinking about natural skin health. And then also I think, you know, that term natural can be a little bit tricky because it doesn't really mean a whole lot. You know, there's not like regulation about how that term is used. Yeah. And it doesn't automatically translate to safe. You know, a natural ingredient doesn't necessarily mean that it's safe. And whereas, you know, a synthetic chemical doesn't necessarily mean it's unsafe. And that term chemical is completely a generic term too. So the natural things are really chemicals as well. So I think you have to be diligent about actually really doing your homework on these ingredients and figuring out the data. And sometimes there's not data, so that's frustrating too. But I don't think you can just, you know, look at a label that says natural and know that that's going to be necessarily better. Yeah.
I love Beauty Counter and how they're focused on that clean and natural. And so I couldn't agree with you more. And for those who don't know, beautycounter.com, not an ad, just I like what she's doing.
Yeah, I think that's really increased awareness about, you know, what we're putting on our skin and how much absorption we get. And there's so many unanswered questions here. But I think it's really important, and I think we're learning more.
Yeah. And so during this time, you know, it's a great time to reset all of our skin. I mean, everyone's skin, you know, and especially because our regular routine is disrupted. Is there any at-home treatments that you can level set your skin when you're at home?
Yeah, so I think
Did you
that.
Freeze?
Oh,
hello?
Am I frozen? Yeah.
Hello.
Still.
I guess.
Oh wait, back. Yeah.
Okay, you're back.
My Wi-Fi is not terrific here, so I apologize.
In sunny Florida, the Wi-Fi is not great. That's terrible.
I know, right?
So just to jump back in. So I don't know if you heard my question, but I'm going to say it again. During this time, you know, this lockdown, it's great to reset our skin. especially from our regular routine is being disrupted. Is there any at-home treatments that everyone should be thinking about to level set their skin?
I think it's a great time to experiment, be more aggressive with skincare because we all have the time to do it right now, and we also have more downtime. So I think it's a great time to add in or increase doses of active ingredients. Okay. So, start the retinol or the prescription retinoid, because even if you get a little bit of irritation for a couple of weeks, this is social distancing gives us an opportunity to deal with that. Add in other active ingredients too. Try the at-home peels. That the peel pads are quite popular these days that have a mixture of acids on them that can just offer gentle exfoliation. I think that's a great thing to be adding in. Masks are fun and certainly popular right now, and they accomplish different things. Some are more just hydrating and moisturizing. Others may be offering some exfoliation, but that's great. There are also a lot of these at-home tools like dermal rollers that can, with very shallow microneedles, it can help the absorption of active ingredients, so you can get a boost that way as well. Okay. One other thing that's come up is it's a great time to try a natural deodorant, because if you're a little stinkier than usual for a couple of weeks, this is pretty good timing for that. So that's also a good time to experiment with that.
And so you just touched on a topic, masks. So I just read something and watched the news this morning about masks are causing breakouts. And they're very popular right now. Any recommendations on how to deal with that for people who are novice and just trying masks and they're getting breakouts?
So one thing that's been in the news a lot is how wearing face coverings can affect acne. So that's a different kind of mask. Yeah. So right now the CDC is certainly recommending that we all wear face coverings when we're in public, and especially if we can't socially distance. And so the occlusive nature of a face covering like that creates a warm and humid environment, which can increase oil production. So that can lead to breakouts as well as irritation and inflammation. So that is, I think, definitely a hot topic right now. So my recommendation is to wash your face with a foaming cleanser before and after wearing a mask. And if you're particularly oily and acne prone, then look for a salicylic acid cleanser, because that's a beta hydroxy acid that penetrates into the pores to exfoliate and also remove excess oil. So that'll help you prevent those kinds of breakouts. And then use a gentle moisturizer to support the skin barrier, so that extra humidity isn't going to cause irritation and inflammation. And then also we see just skin irritations that come from the friction of wearing a mask. So like if it's tight behind your ears, for example, or over the nose, you can get some breakdown of the skin there, and treat that afterwards with something like Aquaphor ointment, just to support that skin barrier as much as possible.
Okay, thank you for that. And so there are many articles out there for women that talk about how they should be caring for their skin in their 20s, 30s, 40s, and beyond. Can you walk us through how men should be taking care of their skin in these same age markers?
Yeah. So again, I don't, in my head, I don't really separate it out as so much between, men and women, or even between the ages. I think that, yes, of course, we may have different concerns at different ages, but in general, the active ingredients that are proven to be effective are not going to change. And things that we do for prevention are often the same things we do for treatment. So, it goes back to my number one, sun protection, number two, retinoid, number three, antioxidant, and then combine that with gentle cleansers, moisturizers, and exfoliation.
Okay.
And so I think that is true for men and women, and I think it's true for all ages.
Okay. I love that, Doc. I love that. And so another question, because I love this topic, why do you think there's a stigma around men taking care of their skin the same way women do?
Yeah, good question. I mean, culturally, I think that there's just these kind of useless stereotypes about, you know, men not being as interested in how they look, you know, and that translates into fashion as well as beauty. And I don't think it's true, and I don't think it has to be true. So yeah, I think that, you know, when for example, so I guess where those stereotypes might come from, because there may be a grain of truth in it, is often when, let's say I'm treating two 19-year-olds for acne, and one's a male and one's a female. To generalize, I would say it's going to be a lot easier to get the female to do exactly what I tell her. Use this cream in the morning, wash with this, use this cream at night. She'll do it. With the guy, I've learned that it's, I'm usually going to meet more success if I use like one combo product and I'm like, use this once a day, done. It's usually going to be more effective. So, you know, yeah, there might be some truths as far as just how interested we are, how motivated we are to be applying things. I think men, just because there's less of a tradition of applying, you know, stuff to the skin, that they sometimes don't like the feel of it. And so depending on the guy, I sometimes recommend more gel-based products, things that aren't as heavy, certainly things that aren't as perfumed. That's generally going to be more appealing. Some of that's because of, you know, there's more hair, so you don't want to apply like a thick cream over hairy areas. Something like a gel base is going to be a little nicer.
Mm-hmm.
But it's completely individual too. And I certainly have plenty of male patients who are extremely interested and motivated to practice fastidious skincare.
Yeah, we want to look good and feel good as well.
Yeah.
And, you know, how do you think the beauty and skincare industry would change post-COVID-19?
Very interesting question.
Mm-hmm.
I think that we are going to have to take so many more precautions about, you know, in-person interactions. So the more that we can do virtually, remotely, the better. So teledermatology is certainly flourishing right now in a way that it never has before. And it's challenging. You know, you really can't see as well. But there are some things that we can accomplish in a teledermatology way. So that I think it's going to continue to be way more popular than it ever has before. And then I think when an in-person interaction is necessary, we're just going to take a lot of precautions. So I was reading a document that our office has put together for, you know, things that we're going to institute with reopening. And yeah, we're going to single book, so there's never more than one person in the waiting room, and we're going to ensure that by how we schedule, and also people are supposed to call in before they arrive so that we can make sure they can come in. Mm-hmm. We're going to take their temperature right away. They're going to have done all paperwork online so that no one has to touch any paper, pen, iPad. And of course, gloves and masks and hand sanitizers. We're not going to be using certain laser procedures right now, just because it increases risk of contracting too much. We're going to take good histories about travel and symptoms before they're allowed to make an appointment. So, I mean, this is going to affect day to day a lot.
Yeah.
And I think that that's going to translate into manicure, pedicure appointments, facial appointments, any sort of med spa, because, you know, so many of these procedures, like, your face is near their face. Like, mm-hmm. This is going to be really high risk. Yeah. So I think we have to be very thoughtful in how we move forward. And I think that at least for a while, all of this stuff is going to be less popular because it's not essential and it's risky.
No, I agree. And so how does the lockdown affect your practice and business? And have you been able to find other ways to help your clients?
Yeah, so I definitely have not been able to see patients in person. So that's my main job. Yeah. Yeah. So I've definitely not been working as much. But I have offered teledermatology appointments. So I've definitely been able to do that. And it makes a lot of sense for example, patients I already know and I already have a relationship that they need to check in because they have questions, or they need to tell me that, oh, this prescription isn't working so well anymore, let's try something different. Those are things that I can take care of very easily with teledermatology. Other things like a skin cancer check, not so much. So I am eager to get back to some in-person appointments for things like that. And then of course, cosmetic procedures you can't do over teledermatology.
Yeah, you can.
But it has given me time to focus on my Instagram account. So trying to bring information to.
I mean, tell the world your Instagram account. Tell the world yours.
At Dr. Hadley King, please follow. I've been trying to offer a lot of relevant tips about some of the stuff we've covered today as well. You know how to care for your skin in the context of wearing a mask. What are things you can do for your skin while you're at home? What can you do to make your Botox last longer since you can't get it in the office right now? What to do about the dry skin that we're on our hands that we're all experiencing from washing and hand sanitizing? Things like this, things that are relevant. So I try to give my audience lots of information there, and also gives me time to do more podcasts and so trying to make the most of my time.
Yeah. Well, that leads me to my next question. What you're doing as the world's on pause, and you've kind of answered that. So I dig it. I dig it. And so on a personal side, how are you managing living day to day during this very unusual time in our lives?
So I was in New York City when it started, and I stayed there in my apartment for 3.5 weeks. And, life stays so busy, especially in New York, and with juggling so many different jobs that, despite obviously the terrible things that were happening outside, I was grateful for the time to just kind of slow down and tackle projects that I had not had time to tackle, as far as doing some Marie Kondo cleaning out and organizing paperwork. So I was grateful for that, and I tried to keep a routine as much as I could, waking up at a normal hour and doing some version of a workout at home, and checking in on news, and then focusing on the writing that I do for different beauty magazines and online outlets, and then in the evenings I would try to always schedule a Zoom call with friends, talk to my mom, just check in with everyone. So trying to still stay social to some extent, stay healthy, stay busy. Yeah.
Can you share a little bit the names of the articles the magazines that you write for, so maybe some of the audience could read some of your stuff besides look at your social media?
Yeah, so I post a lot of them in my Instagram account,
okay.
But just lots of different outlets. I'm very grateful, I will say, to Tiona Ostrov, PR. She connects me with a lot of these beauty editors, so shout out to her. So everything from CNN to Women's Health to Elle, to Cosmo, 17 magazine. The list is pretty long.
Okay, I love that. I mean, you are a pretty smart woman, so I dig it.
Thank you.
And so for the argument that a lot of men make for why they don't care for their skin, that they don't care how they look, what are some of the reasons why skin health is important that is not about looks?
Yeah, so certainly, sun exposure is a big one. That, yes, of course, sun is going to cause premature wrinkles, fine lines, saggy skin, discolorations, but it also gives us skin cancer. So you've got the cosmetic reasons to care, and you've got the medical reasons to care. And then like some things like moisturizing, as we learn more and more, use of moisturizing, it's actually been recently shown to potentially decrease risk of Alzheimer's disease and possibly Parkinson's, which is fascinating. And we need to learn more there. But the idea that skin health does contribute to other aspects of our health, I think is well established and very interesting.
Wow, I didn't know that. I mean, I love the moisturizer, but this is good information. I'm gonna have to do some digging on that. This is really great.
Yeah, that's why you have such beautiful skin, Troy.
Thank you. And so is your schedule already booked up for those who are looking to be super refreshed when this is over?
Oh, so, it's been so challenging because we really don't know when we're reopening yet. So, I have a list of people who have reached out and asked to have first priority when things reopen. So I'll definitely be busy, but there's always room for new people as well.
That's incredible. So for all the women that are listening right now, what advice would you give to someone who wants to start their own business or practice?
I mean, I think go for it. It took me like 12 years before I finally did it, and I'm so happy that I have. And I think the biggest lesson for me has been that you can really make it work for you. I think for the longest time, the idea of starting my own practice was so intimidating to me because I thought that I had to do it the way that I saw these other practices do it, and that it would take over my life and I wouldn't have any free time left. And I have really been able to figure out how to do it on my terms. It's a very small practice, but that's great. It works for me. It means that I get to do my own scheduling, and that means I get to spend as much time with patients as I want to, because I think that's one of my strengths is I like to explain and I like to listen. I'm not so good at the practices where there's just constant turnover and there's not a lot of time with the doctor. That really does not speak to my strengths. So you can really do it on your terms. So don't be intimidated by how you see other people do it if that's not going to work for you. Be confident, believe in yourself, and do it in a way that makes sense for what you want.
Oh, that's beautiful. That's beautiful. I love it. I love that. That's really great. And so as we prepare to end, I just want to say again, thank you very much for taking the time to be on groupTHINK. This is episode number 7, so this is really, really good. And as we prepare to end, I want to thank all the listeners and everyone who's here today. And what would you tell your 18-year-old self?
Oh gosh. I think very much along the lines of what I was just saying is with confidence. Believe in yourself and know that even if how I see myself it isn't exactly like the image of perfection that I was hoping for, like, believe in myself. We're all different in our unique, beautiful ways, and be confident that your gifts are valuable.
Oh, thank you so much, Hadley. You stay safe, and we will have to have a drink once this is all settled.
Sounds
okay?
Good. Thank you, Troy.
Thank you. Have a great day.
You too. Thanks.
Bye.